what caught your eyes and attention, including data you were part of and so on, in mutation-driven early stage lung cancer?
Yeah, so there's a few things. I mean, even before World Lung, we've been trying to figure out how to bring targeted therapies into the earlier stage settings for our patients. And so just to even go before that at ASCO, we started asking the question about if we can use EGFR targeted therapy earlier on before patients go for surgery. And so that was the NeoAdora study. And the NeoAdora study looked to see if you could give osimertinib before patients got surgical resection. And was there truly a benefit? So they're looking at an endpoint, a pathologic endpoint known as major pathologic response. So how often before a patient goes for surgery, you give them neoadjuvant therapy, are they getting major pathologic response? And we didn't really have big randomized studies before that point to figure out or get that answer if there's truly a benefit of introducing neoadjuvant therapy up front. And what we saw at ASCO was that you had about a 25 to 26% major pathologic response for patients that had EGFR positive disease, and they got osimertinib, a third generation EGFR TKI, and then went to surgery. And so I think that started to have us chew a little bit more on trying to introduce oral targeted therapies even before you get to adjuvant, right? Like neoadjuvant. And that's been a question that's been sort of lingering for a while, not only with EGFR positive disease, but other biomarkers like ALK, for example,